Welcome to Children's Pedcast, a conversation about pediatrics with children's hospitals and clinics of Minnesota. I'm Jimmy Bellamy, and I want to put extra emphasis, on the clinics part of children's hospitals and clinics of Minnesota. This episode, we talked to Dr. Gigi Chawla, our Senior Medical Director of Primary Care, and we covered all things well-child visits. A lot of people know we have hospitals in Minneapolis and St. Paul, as well as a surgery center in Minnetonka, but we also have 13 primary care clinics throughout the Twin Cities metro area. It covers a 50-mile by 50-mile radius, and we talk about things that parents should prepare for a well-child visit, what kinds of questions a parent should ask, what's his or her role in the annual exam, and then also how to find a great pediatrician. What's the pediatrician's role? How do you schedule an appointment? I've always said you cannot ask a dumb question. There's no such thing. So I asked a lot of questions and got a lot of answers. We hope you enjoy the episode and find it informative. And also, you can find us on the web at childrensmn.org. We're on Twitter at childrensmn. And then you can find the podcast anywhere a podcast is available. We recommend iTunes, where you can rate, review, and subscribe to the podcast, where it will download automatically to your device. And then also we're on Podbean and Stitcher. And then just for good measure, I put the episodes on YouTube and Vimeo. They're audio only, but that's a great spot to find them as well. Sit back and enjoy. Have a great week. Yeah, thanks again for coming. Appreciate it.
Oh, great. Thanks for having me.
Yeah. What's this time of year like for you? Is it extra busy, or is it the same every month?
Yeah. So as you might guess, pediatrics is pretty seasonal in clinics, and this is still a very busy time for us from an illness standpoint, from a viral season illness standpoint. But pretty soon we'll be going into our well-child check season during our down illness season. Usually the summertime is a little bit quieter from that standpoint, and it's a time that families are really looking for their well-child checks to happen.
And this is something that impacts all kids, all parents, all families. What would you say to a parent that says, well, my child is fine, I don't need to take him or her in?
Yeah, I mean, I think a lot of families really feel that way. And if you are looking at it from a pure health standpoint, my child is free from illness, you might actually be right. But there are good reasons why your insurance company and why all the Academy of Pediatrics or family practice really promote having well child or well preventative health care visits, because it's really not just about ensuring that physically you're healthy, but ensuring you're making good choices for yourself, and that all aspects of your life you're headed into what we would think of as a healthy lifestyle.
What kinds of things are done at these checks? I suppose it varies depending on the age of the child, the stage of development, but if you could take us, whether it be through infancy into teenage years, what can somebody expect by bringing a child in for this?
Yeah, I think that's a really good question, because a lot of kids actually come in and they're very anxious and wondering what's going to happen. So informing parents to really make sure they know too can be super helpful. But really, at each of those well-child checks, we are focused on ensuring that from a nutrition standpoint, people are making healthy choices for themselves, that physically they're making great choices from themselves to stay active and fit, that their body works well for them in those instances. And then we do a lot of screening, actually, to make sure that we're seeing patients whose development is matching age-appropriate expectations, and ensuring that from a social and emotional standpoint, they're meeting some of those milestones. And that also we screen for things like depression and anxiety. So it's actually a time where we're looking at a full body approach. I think the other thing to understand is that well-child checks are times that we give vaccines for kids to stay on track to get to school, and also occasionally a time where we look to do routine blood draws to document that physically they're doing well also.
When you're doing something like this that is annual, are there times where guidelines change, and if so, is it a decade that passes and then something, whether it's through research, changes, or is it being looked at every year by professionals saying, okay, for well-child visits, we're now going to look for this, or we're now going to do this way?
Oh, I think that's something that changes in real time on a moment-to-moment basis, actually. There are lots of organizations that are looking at what is best practice for the health of children and adults. And so while I wish I could say this is exactly what you're going to expect, that changes over time, thankfully, as we become smarter as a medical field.
I remember back to some of my well-child visits, and that was usually a time for me to catch up on my People magazine reading.
Mm-hmm.
But what would you say to a parent who's bringing in a child to help occupy the time of the kid, or prevent boredom, or make it a little more pleasant? Not that it's an unpleasant experience, but like you said, some kids come in maybe a little timid about what's about to happen. Would you recommend bringing in toys or anything for the kid?
Yeah, I think you do want to have your child be able to be somewhat occupied during at least part of the visit, because part of it is really directed to the parent. Like, how are you perceiving your child's health and development and trajectory to go? And not every single question is going to be directed towards the child to answer. At some ages, they don't answer. But really, it's about how the parent perceives some of these steps to be occurring as well. So anything that could be done reasonably to help keep your child engaged in your conversation, but also not bored, would be awesome, right? A lot of families bring their phone so that kids can play a little game on the phone, or others bring a pile of books, or even their favorite toy, but just something so that they can remain somewhat entertained on their own for brief moments of time while the adults get through some of the tough questions would be great.
Now, this might be a silly question, because kids are being born all the time and there's never really an off season, but is there a better time of year to bring a child in for a well-child visit?
I think a lot of families try to bunch their well-child checks during times that are convenient to keep them still attending school regularly, or their camps regularly, and that's fine. When we think about when are well-child checks really best used or best taken, it's at those regular intervals. So for infants, at those 2 and 3 month intervals are appropriate. Annually, it ends up actually working a little bit better if it's close to their birthday, but it could be done at any time of the year.
What are some things you would say to a parent who says, well, every time I bring my child in for a well-child visit, he or she comes home sick?
Mm-hmm. That's a good question, and I think that is probably a major concern that parents actually have. Please don't make me ill from coming in when I was well to begin with. I think most clinics do a really good job of ensuring that we do the very best that we can to keep kids healthy. So you'll see foam at every clinic doorway. Please utilize that yourself. All the clinics are wiped down in the same way with sanitary type treatments so that the rooms are healthy. But you're right that there are shared toys in lobbies and experiences that you might have within lobbies that could potentially expose you to illness. Now, I would think that actually your exposure to illness in a clinic is less than you going to the grocery store with your child, right?
That's a good point. People don't think about that, whether it's touching a shopping cart.
Right.
A lot of these doors are automated, but a lot of them aren't. If you go to a mall,
exactly.
A lot of those doors aren't automated.
Exactly. And at least at a clinic, when you come in with an ill child, if you are coughing, we're putting a mask on that child. Versus if you are at the grocery store and you're just passing by someone, they're potentially coughing right in your face. So I think that although it is a concern, it is certainly less of a concern coming to clinic with a well child than going to daycare with a well child or a grocery store with a well child.
That's true. Everywhere you go, you're at risk for picking up something, especially
Exactly.
where the public is gathering.
Exactly.
We have a lot of places you can go in the metro area for well child visits. Where are some of them? If a parent's wondering. Now, I know Children's. I know they have a hospital in St. Paul. I know they have one in Minneapolis. But where else are we?
We're really excited about our ambulatory presence, actually. So we have 13 pediatric clinics across the metro area. One of them is an adolescent clinic that is at the Minneapolis Children's campus. But otherwise, we have then 12 general pediatrics clinics. And they're spread all over the metro area in a 50-mile by 50-mile radius. So there are 5 partners in pediatrics clinics that are children's clinics. There are 3 metro pediatrics clinics that are children's. There are 2 hospital-based children's clinics on the Minneapolis campus and on the St. Paul campus. And then there are 2 clinics, one Pace Pediatrics out in West St. Paul and one Northeast Pediatrics clinic in Hugo. So we truly represent a great swath of the metro area, and I know you would find a location close to you.
Yeah, and it's incredibly convenient. I'm new to the area as of a year ago, but to see the map of the metro and see the children's stars located where we are, it's amazing to see all of the ground children's covers.
Exactly.
One thing I wanted to talk about too is school physicals. I remember in middle school and high school specifically having to take them for athletics come fall. Is there ever a backlog as far as people trying to schedule it all around the same time in August? Would you recommend people spreading those out?
Yeah. So I think that has been kind of the standard, is that everybody in the summer times tries to get in their camp physicals and their sports physicals in preparation for the upcoming year. And it's a challenge to get that in. And in the past, it has limited kids' abilities to get into their sports in the fall because they were not able to complete that. So I know that is a real struggle for families. I guess my only suggestion would be to really think ahead and understand that actually any time of the year is a great time to get your physical. And so closer to your birthday may help you remember and be able to get that physical in preparation for any time that you would need it, be your camp physical or your sports physical clearance for the upcoming season. I think the other thing that we've really done as an organization, which I'm really proud of, is offered more evening clinic availability and more Saturday and Sunday clinic availability so that potentially you could get those school physicals or sports physicals or camp physicals done when your child doesn't have to miss school.
Every case might be different, but is there an average amount of time that you'd spend from start to finish in a well child visit, from the time you walk in the door to the time you leave?
Mm-hmm. So most of those physicals are scheduled for about 20 minutes. Now, if things come up, for example, your child also has asthma or other health conditions, those visits might take longer. And I do think that, if you're in an age group where there will be vaccines or there will also be laboratory blood draws, that those would be additive times.
When it comes to scheduling, many of the well child visits, I know parents schedule them in advance. Some may say or be nervous about there being a silly question or a stupid question, but I assume you can reassure people that when it comes to this, there really is no such thing as a stupid question. One mom I know said that she will make a list and bring in Post-its of this is what I thought of, this is what I thought of, from the time that she scheduled the appointment to the time it actually happens. Do you recommend doing something like that?
Oh, I think that's a great idea. I very frequently get that message that, oh my gosh, I had so many things to ask and I can't remember what they were. So really writing those questions down or concerns down at any time leading up to your physical is a great idea for parents and kids so that they get their questions answered. And I really do not think that there is a stupid question. If it is a question that's important to you, then that's not stupid. That's exactly what your checkup is for. I think people are sometimes self-conscious about that, but I can tell you that we get questions of all sorts, and we're really able to answer a lot of things for you.
So for first-time parents, what should they expect with that first well-child visit?
Mm-hmm. For a baby, your very first well-child visit is usually right around that 2-week mark. And that's one where we're ensuring that you and your baby are bonding, that feeding is going well, that you're starting to establish a pattern for sleep, that you're bonding with each other and understanding each other's needs, and that you're just learning how to parent. I mean, it is such a challenging time. We just want to make sure that process is going well for you, that weight has been at least steady and maybe even gaining weight by then. So it's just really that first step into ensuring that your baby's health is on the right trajectory.
Now, I know a lot of people labor over, no pun intended, choosing a pediatrician, but I can also assume it's important to maintain a good rapport with a pediatrician for a long period of time. That would benefit you as far as that expert knowing you. I know that, of course, no one knows a child as well as a parent, but to have that established rapport with a pediatrician must benefit, as opposed to maybe not being able to stay with the same one due to a number of circumstances. Maybe that person moves to a different practice, or maybe the family moves. Talk about long-term rapport as opposed to trying to find, the right pediatrician.
Yeah, I think that is something that perhaps families don't weigh enough at the onset, is that what they're really looking for is somebody to be part of their family for the next 2 decades, right? I mean, you really are going to be seeing this person regularly and entrusting them with care and with guidance for your family. And so really it has to be somebody that you feel like you have a good relationship with, that you can bond with, that listens to you, that thinks the same way that you do, that reaches you in a way that inspires you in some way, and that your child can bond with. And I think that's the part that's also really challenging, is you bring in a brand new infant and you don't know what your baby is going to want in their teenage years. And so you're also looking for a practice that has that breadth to offer. And so although you as a parent might like somebody who you can really talk to, that's a woman, your son in 12 years might really want somebody who doesn't talk a lot about, some of those emotional things, but instead can talk a good game of sports and is a guy. So you want to look for a clinic that could potentially have that breadth of base, but also that ability instead to take you through an entire 2 decades of life if you wanted it to be that way.
And that leads me to the next question about the role of a pediatrician. There's so much to cover in these visits. What are the main things, and then what are some secondary things that a parent or child wouldn't think about that a pediatrician does as far as his or her role in these visits?
Yeah, I think it's pretty easy to say that your role is maintaining the medical health or the physical health of a child, but that's really just the top of the crop of what we do. The bulk is really ensuring that the child and family are growing well and stay healthy together. And so that is, not just physical and medical health, but also emotional health, social health, developmental health, and safety. I mean, safety is such a huge thing that especially new parents may not recognize right off the bat, that it kind of takes that role of being more of a guide to get your child from birth to 21, not just as a health person. I
guess on the other side of it, what is the parent's role, other than of course, schedule, take child in. I know it's certainly more than that, but how would a parent participate in the visit itself?
Yeah. So I think parents really participate by driving the conversation. Really, they need to let us know what are the things that are important to you in the way that you're raising your child, and let us help guide you to ensure that your choices are healthy choices for the two of you together.
Is there anything we didn't cover when it comes to the preparation of a parent for the visit?
Yeah, actually, I think the one thing to really prepare families well for is your adolescent visits. And so adolescence is really a time where we start to give kids that independence. And up until that 12 or 13-year-old visit, parents will be very prepared to go in the room with the child, answer the bulk of the questions, or confirm their child's answers in some way, and be present during the full exam. And starting in the teenage years, we really start with an opportunity to give children some independence, and to ensure that they're making healthy choices for themselves, because oftentimes they really are making choices that maybe parents do or don't even know about. And we want to make sure that we're a resource for children and teenagers to stay on that healthy path. So we will typically start a physical or a visit with the parent in the room and address some of the parent concerns, and then ask the parent to leave. And that is sometimes a really uncomfortable moment if parents aren't aware that that's going to happen. We try to do a really good job of educating them along the way that it will. And I think the other piece of education is that kids need to be educated that that's what's going to happen as well, because otherwise there are some younger teens that are also feeling somewhat uncomfortable by the idea that they're in this room with an adult that is going to be asking them questions. But it's not to make the situation uncomfortable. It's to offer a child that opportunity to share and ensure that their health is really on the right track.
And if there is ever a case where the child's health is maybe not where it needs to be in that setting, in that family setting, what kind of steps could a pediatrician take in that case?
Oh, lots of good steps. First of all, we really make sure that if kids do not want to be seen alone, that's fine. Then that would not happen. But I think giving them the opportunity to have that alone time does oftentimes raise things that have that opportunity to give pediatricians a chance to redirect their health. And those times, sometimes we might just counsel them. Sometimes we might ask kids to come back or give them some things to work on and have them come back, almost like homework. Or sometimes we might have social workers available or other health specialists that we would think of incorporating, such as therapists or therapists at their school. So I think there are a variety of resources that we have to help kids in some of those uncomfortable situations that we have found ourselves to be in. But it's a good kind of uncomfortable, because then we're getting to things that have an opportunity to make a difference in a kid's life. So we're really happy about those times. The other things that I wanted families to feel really secure about is if we find ourselves that in a situation where a kid has disclosed something that is dangerous or something that is life-threatening or whatever, something very challenging like that, we will also alert the parents. So it is, I know, a gray zone, because some families want to know everything, but they have a right to their privacy as well. So if there are definite dangerous situations, we will counsel the kids that we need to disclose this to their parent, or bring the parent back to the room and counsel kids that together we are going to disclose this to the parent. Or if the kid just doesn't really want to do it, bring the parent back to the room, and in front of the child, we'll disclose to the parent some of our concerns. But I think it's again, a really great opportunity for family building and to ensure that kids are staying as healthy as they can be.
And that seems to go into the whole body approach of care, not just, okay, physically you seem fine. It's covering every area of a child's health, both mental health, emotional health. What kinds of things would you do for times, because they are annual visits? If somebody misses a year, are there things you need to do the next time to catch up? I assume when it comes to vaccinations, that would become a little more difficult than, say, a visit that didn't entail a vaccine.
Yeah. So first of all, patients or families should never feel badly about missing a visit. We understand that, life gets in the way sometimes of making those scheduled appointments. So we're very adept at making sure that patients stay up to date with their vaccines, regardless if it was supposed to have been given 3 months earlier or a year earlier or 2 years earlier. We have that capacity. That's fine. But you're right that, staying up to date with your well child checks is something that we want to promote. And so if it didn't work 1 year, we will get you in and incorporate everything that needed to happen over those 2 years in that one visit.
There might be some questions parents have that they wouldn't think to ask a pediatrician, but things like whether it's related to car seats or safety around the home through keeping the child away from chemicals. Those are things that pediatricians would be able to help with as well, right?
Oh, absolutely. I think that's one of our areas of expertise, is really ensuring that children stay safe and healthy. I think the other area that parents frequently forget that we're around for, or that we're here to help with, is their behavior. And so frequently families have challenges around setting limits or redirecting kids to be more positive, or in just basic parenting skills. And a lot of those skills, decades or centuries ago, were really easier to acquire because families, huge families, extended families, raised children together. And your grandma would have lots of experience on what to do with this behavior or that behavior. They've seen it in the other 20 grandkids and know how to manage it. And now, living the way that we do, we just don't live in extended families to have that breadth of knowledge. So pediatricians really are there to cover that gap.
It's interesting to me. The job must require so much juggling, because while you have a level of expertise that tells you, for this situation, this is my recommendation, but since every child and every family are different, you must also take that into account, which I think the long-term rapport comes into play. How often are you, and I don't know if you could break it down by percentage, but how often are you giving this is what you do for this situation compared to, all right, this is unique because of the family and the child and the situation, that you're almost crafting an appropriate response for this child, as opposed to this is what we do, this is the standard?
Yeah, I think it's probably 95% of the time that we're crafting it for the individual patient and family. And you're right, I think we get better and better at it if we really have a stronger relationship with the family. But it's very rare that we dictate, this is how you shalt do this.
Yeah.
But instead really more, these are the things that I've seen that may help you. And knowing how you and Johnny work together, these might be the few things that you might give as a trial to help in this situation. So I think, again, it's more of a guide than truly saying this is how you should do this.
For people looking for a pediatrician, what are the things that should be top of mind when looking for the right pediatrician?
Yeah. I think it really has to be about your sense of priorities and what is really important to you. I think families really choose pediatricians based on a lot of different things. One is access. Like, how easy is it to get physically to the clinic. What is parking like? How often can I get in to see my actual pediatrician? What are their hours of operation? Could I see them at this time of the day or that time of the day or on the weekends? So I think access is a definite important value add for families to consider. But then there's that whole like true relationship piece, and it's all about how do you bond with somebody? How do you interact with them? Do you feel heard? Were you treated with respect? All the things that you would be looking for in a life partner. And if you think about it that way, how are you looking for a life partner? Then I think you're going to make the right decision about how do you find your pediatrician.
And when it comes to scheduling an actual appointment for people locally here in the Twin Cities area, what would you recommend they do? And then also for people listening in general terms who maybe are somewhere else in the United States or somewhere else in the world, what should they do?
How do they schedule an appointment?
Yeah.
Well, through our children's system right now, we're working towards a centralized scheduling model. So there would be a one telephone number access. We're not there yet. We've got work to do. So at this point, it really is about contacting any of your clinic directly and working to schedule an appointment. At any of those times, they'll say to you as a parent, do you have a specific provider that you would like to see? Or is there a specific day or time of day that you would like to work with in order to find somebody? And that really represents an opportunity for the parents to decide, what is my most important value? Do I have to get in for this sports physical by this date? And it doesn't matter who I see, or do I really want instead the advice of this one person that I've been valuing for the past few years?
Now, when it comes to scheduling, if you have more than one child, do parents usually go to one visit and have all of the children taken care of at the same time? Or is it closer to birthdays that, well, my kids have birthdays at the opposite time of year, so you're going in one and then coming back for another?
Yeah, I think families look at it both ways. And certainly it depends. If your children are completely 100% healthy with no medical things to chat about, and it's easier for you and your young kids to bring them both in together at the same time and do your well child checks, great. We just want you to get your well child checks. But sometimes it can be also very challenging to bring two kids in back to back, because then for the children, the visit becomes twice as long and they need to be engaged in something to keep themselves busy and not bored twice as long, which is a challenge, I think, for some children. Or if kids have certain health concerns, or you want to be able to speak frankly about one child without having to say it in front of the second child, then you may want to think about getting those visits done separately. So I think it's really up to parents on how they want to schedule those appointments. I have two kids myself, and I have at some times in their lives scheduled them back to back when I did not really think that I needed anything specific to chat about. My concerns were really nothing significant. But at times where I wanted them to have that own individual privacy, or there were concerns that I had and didn't want to address in front of each of the other children, I scheduled them separately.
Primary care often takes a back seat to emergency care, just because to some people in their minds, when they think hospital, they think it's not something I planned. I have to go now. What are some things about primary care that really stand out that people need to know, that it might not be top of mind for them?
Yeah, I think, primary care is really our opportunity to ensure that kids stay on a healthy track and they never end up in the emergency room, right? So much of the time that kids end up in the emergency room is because of a safety issue or a healthcare issue that went amiss, that was awry in some ways. So from a safety standpoint, boy, we really hope that at our primary care visits, we have the opportunity to talk about all those things that we could do in order to keep your child healthy and not end up getting stitches or a broken arm or hit by a car or any of those things that could potentially help you in some ways find an emergency care service. For the illness that has gone unchecked or out of control, things like asthma. Okay, asthma is probably one of the leading diagnoses why kids end up in the emergency room. And instead, thinking about how we could better serve your child's care in a preventative visit so that you're not seeking that emergency room and emergency room bill is, boy, a healthier way to be managing your child's health.
That was not, for those of you listening, that was not the microwave beeping. That was Dr. Chawla's pager. Feel free to check it if you need. One question I had too is pertaining to late adolescence. What are some things that pediatricians do to kind of instill the habit of going in again annually for when adulthood comes around too?
Well, I think through early childhood, infancy and early childhood, we've been able to really stay on track with those scheduled visits because there are vaccines. And families remember that they have to get their vaccines. So now, fortunately for us, yay, there are more vaccines in adolescence as well. So I think some of those are great opportunities to ensure that kids return for their annual visits, as well as sports opportunities for physicals then too.
Is there anything else that you'd like to touch on, whether it be about ambulatory services or just anything in general that you really think parents need to know or maybe are wanting to know?
I think that really families have not utilized primary care as well as they could. And Children's is really taking a stand right now to say, hey, we are there and available, and we're going to be part of your answer in maintaining your child's health. So I hope families really utilize us.
I appreciate the time, Dr. Chawla. I know you are extremely busy. We frequently call on you for a lot of our media work, and you're always there, but it's appreciated even more because we know just how busy you are.
Oh, thanks so much for having me. I really appreciate it too.
Thank you.